Hey, everybody. Thanks so much for tuning in to this edition of Passion for Patients podcast. I'm Tonya Winders, your host, the president and CEO of GAAPP. And I'm excited to sit down today with Kristen Willard, our vice president of education. Kristen is going to play the role of host today, and I'm going to be your guest as we talk a bit about some of our advocacy work here in 2025. So, Kristen, thanks for coming in and for filling my shoes today.
Yes, this is quite the honor. Thank you so much. And thank you for explaining more to us about the resolutions and what these mean and what it means for us going forward. So let's start there with the basics.
Yeah.
We've heard a lot as a community about the advocacy that's happening on the global scale, right? At the international scale, the resolutions and the WHA. Put it all together for us. Can you tell us the basics?
So it's very complex when you start thinking about policy at a global level. We have the World Health Organization, the WHO,
Yes.
is what it's called, and it's been in existence for decades. Unfortunately, there's never really been a line in the sand that says we must prioritize airways, lung health, and atopic skin health, skin diseases.
Got it.
And so currently at World Health Organization, there is no staff really dedicated to skin disease in that non-communicable disease area. And there is only 2 staff that are dedicated to the lung health area. So think about all the different lung conditions. Outside of tuberculosis, they've got their own house at WHO. But asthma and COPD have a very, very tiny house with only 2 people working in that space all the time.
Wow.
And so what these resolutions do is actually bring it before the World Health Organization and say, this needs to be prioritized. We need to elevate lung health and skin disease to ensure that we get our share of the voice, that we get our share of the resources, and that member states, governments throughout the 200 countries that are represented at the World Health Organization begin to also prioritize these conditions. So this resolution is very vital to just helping us get that recognition and awareness that these are important conditions that deserve our attention.
That's really impressive and so important when you put it all together, when there's context of how little resources are devoted at the current time.
Yeah.
So before we get into the tenets of these, how much power does a resolution have? Is it really powerful if that is then adopted and put out there?
So it can be, is the honest answer. It is a first step. It's not the finish line. It's absolutely the very first step. So there's a lot of work. We've been working on these resolutions for 2 years just to get them to this point of being on the executive agenda of actually coming to a vote on May 27th at the World Health Assembly in Geneva, Switzerland. So the work that goes on behind the scenes to get a resolution introduced is one thing. But then once you get to the vote and beyond the vote, it's a whole different matter, because it is that resolution that then allows us to go back to WHO as a global organization and to the countries, to the member state countries, and like to ministers of health, for example, in all countries throughout the world, and say, there is a resolution. Your country voted to support this resolution, and therefore you need to make sure that this is implemented in your own country. So it's, if you will, the golden ticket, is the way I like to say it, to open the door to conversations with ministers of health, governments all across the world to make sure that we get these conditions resourced better.
That's fantastic. I imagine as an advocate, having that in my hand would be so empowering to know that I had the support of all these organizations and people behind me when I went in to make that case.
Yeah.
But I don't want to get ahead of myself. I would love to understand better, the tenets of each of these. So can we start then with the lung health?
Yeah.
Tell us what that's about.
So the integrated lung health resolution is the one that GAAPP has really taken a leadership role. And we've worked with 14 countries to actually get this introduced and on the executive agenda. And just for kind of background, the executive agenda process, about 50 resolutions come through and only about 15 to 20 make it. So we're one of those 20. Actually, we got more than one when we talk about the others. But for lung health, we have a resolution that's on the agenda, approved, and will be voted on. And so this integrated lung health is not just about asthma or COPD. It really is taking a look at lung health from in utero all the way through the life course of one's life and making sure that we prioritize lung health. So think about this for a minute. We've never had a vital for lung health. There, you go and you get your vitals checked at the doctor every year. No one ever checks about your breathing.
Never.
They never ask about it. There is no objective measure. And so this is a way that we can begin to put system policies in place to elevate lung health, to think about lung health from the time a baby is born all the way through until a person passes away. And so the tenets are this. Number one, that there's a global action plan, that WHO puts more people on the project, that we get more resources within the World Health Organization itself.
Great.
Okay. And we've seen this happen before, like diabetes. Once they got a resolution passed, then their staff grew exponentially.
Wow.
So we know that that is the first step of getting that global action plan. And then secondly, that it would call for dedicated health investments at the national level. So making sure that governments allocate dollars in the US or krones in other parts of the world and euros in other parts of the world to ensure that those resources, those financial resources are in place, not only to see health as an expense, lung health as an expense, like we are looking at it today, but truly look at lung health as an investment. And so what are we doing early on to assess and get a baseline lung function by the time someone turns like 18 to 20 years old, knowing what is their personal best, and then following that over time to see how it changes, because we know that diseases like asthma and COPD, oftentimes we see that onset, and through different transitions of life. And so if we have that investment, if we have those resources, we are assessing more routinely, then we'll catch people earlier. We'll diagnose disease much sooner than what we're doing today.
And that's the key.
So that's really the key around the investment piece. The third tenet of the integrated lung health resolution is around indoor and outdoor air pollution. So we know that especially in atopic and airways diseases, environment is vitally important, right? It can make or break a day. If you're in a situation where the indoor or outdoor air is not of the highest quality, your breathing is going to be worse, your allergies may be triggered. There's so many various aspects. And so we know that having this component of investment in clear indoor and outdoor air quality measures is a very important aspect of integrated lung health. The next tenet is patient-centered research, surveillance, and data. So just recently, GAAPP released a asthma access map. And what you would see in that map is that there are regions of the world where unfortunately there is no data, right? We don't even know what the asthma prevalence is. We don't know what the burden is because there's just no formal way of getting that data. And so what we're calling on within this resolution, again, is specific activities of governments to establish epidemiology and burden data.
Amazing.
To get that prevalence and burden data in a uniform, consistent way globally. So we actually know where we're starting. Therefore, we can figure out how to address the burden and do better in bringing that morbidity and mortality down.
That is really impressive. So what you've said so far then is changes for the individual, changes for more at the level of the country and all the infrastructure, right? They're really coming at it from all these different levels to affect true change.
Absolutely. And I think that that's the thing, is that this is a big aim. It's a moonshot, right? It's not a one little piece of the puzzle of lung health that will make a difference. It really This resolution, we believe, will be the foundation for decades to come in the space because it talks about equitable access and the importance of health equity. It talks about integrated approaches to lung health disease management over time so that we're not looked at just as asthma or just as COPD, that we're connecting the dots to all of the other conditions that may be causing the symptoms, right? And addressing the whole person rather than just one part of it. And so this resolution will really be, if you will, that foundation that we can build the house on for decades to come of advocating for policies that make a difference for our community.
It's so impressive. And to hear the passion you have talking about it, it just makes me want to take it forward, right? And I bet that's the case no matter the member organization that we're talking about, the member state, excuse me, member country. So I can imagine the global impact that this could have. And so I know we'll turn in a second to talk about the skin diseases resolution.
Yes.
But the next step for this is that these will move forward then at that meeting in May, right? So that's the next step to see if they're passed through.
Exactly. So we talked about the lung health. Now we're going to talk about skin disease.
Yes.
Okay. So we have partnered with Global Skin, which is a fantastic umbrella organization of about 300 different patient organizations in all of skin disease.
Yes.
And in this particular resolution, they were working in parallel as we were on the lung health on a skin disease resolution. And it got on the executive agenda too. So it's super exciting because this covers things like chronic urticaria, atopic dermatitis, psoriasis, vitiligo. I mean, so many different conditions. And again, historically in WHO, skin disease has been under prioritized, has really been minimized as kind of just a only skin deep sort of thing.
Yes.
And so it's very telling that we got over a dozen countries to introduce this resolution and to get it passed and on the agenda. So now we come to May and we come to Geneva, and before all of the member states, there will be a vote on the skin disease resolution. And it has many of the same aspects and tenets as the lung health resolution.
Interesting.
So we tried to kind of mirror and model them in many different ways. So it does have the global action plan calling on WHO and global authorities to allocate and prioritize this more and allocate resources to focus on prevention, diagnosis, and long-term management. Okay. So it's definitely got that aspect. Secondly, it asks for health investment for the financial resources. And it also asks for greater research and data, because just like in lung disease, we don't have research dollars dedicated to skin disease in the same equitable fashion as many other conditions like cancer or cardiovascular. And we don't have the epidemiology, the prevalence data that we need to even know what the baseline is. So again, you'll see a lot of the same key tenets and aspects in both resolutions, just one focused on skin disease, one focused on lung disease.
It's just, as someone with a skin condition, it feels fantastic that we are getting that attention at the global policy level. It really does, that we are being highlighted in a way that we have not before. Yeah. And certainly we've been doing this for quite a while. I have never seen anything quite this comprehensive in our lifetime. Certainly.
Well, and I think it is, oftentimes we think about skin disease specifically needs such a high level of care coordination and integrated access. And yet, in some countries, it's only dermatologists and it's only through that lens. In other countries, it's only primary care. Like there are no dermatologists at all. And then in other countries, we're beginning to see that care coordination of like allergy, immunology, and dermatology working together alongside primary care. But that's really the exception. It's not the rule. And we want that to be the norm through this effort of the resolution.
And that's the most helpful way to treat these patients, right? Yeah. That's just amazing what's possible. Right. What's possible when you have these in hand.
Yeah.
So there's more, as I understand it, right?
Yeah.
We speak about rare disease too.
So actually, we've just learned that there is also a rare disease resolution that's on the executive agenda. And it is broad. Again, it's not any specific type of rare disease. It's all rare disease. And it's about elevating rare disease and making sure that collectively, because again, can you imagine if you're out there living with a rare disease where you're one in a million, perhaps in your own country, coming together with all individuals, because rare isn't rare. When we talk about all rare disease, it's quite a large community.
Yes.
And it is a significant portion of the globe. We say in lung health that it's about 1 billion people, 1 billion
Yes.
people living with lung conditions and atopic conditions, atopic and airways conditions. So that's 1 in 8 of all people on the planet. Actually, surprisingly, it's about 1 in 10 that are living with a rare disease. So it's not that rare.
No, and it certainly doesn't feel rare to you when you're the person with the rare condition.
Absolutely. So again, in this resolution, much of the same structure of calling on more investment, greater research, better data, the key aspects. It's interesting to me that if you really look, no matter what disease you're dealing with, the journey and the challenges of the journey are oftentimes very similar, right? Delays in diagnosis, not enough emphasis on prevention, delays in access to specialty care,
lack of care coordination, like you highlighted a second ago.
I mean, these are the kind of things that no matter what you're facing, as far as dealing with chronic conditions, that we find are the barriers. So it's really fascinating that there's such common themes throughout these and red threads, as we like to call them.
Yes.
But as I said, we're going to get to May. We're going to have the votes
soon,
May 27th. After a real whirlwind of about 3 or 4 days. We've got a number of side events that are hosted by GAAPP, by Global Skin, by our industry partners, all coming together to get these resolutions across the first finish line and to get that positive outcome of the vote on May 27th. And so once that happens, then we turn our attention into implementation. And we have yet another major milestone later this year, and that is the United Nations General Assembly. And that's coming up in late September. So it's going to be held September 23rd through 27th in New York City. And on September 24th specifically, there is an emphasis on non-communicable diseases. And it's called the High-Level Meeting on Non-Communicable Diseases. And on that day, we are going to be calling on member states to pass a follow-up to these World Health Assembly resolutions, to implement them, and to prioritize within the NCD agenda. Okay, so this is the chance at the United Nations to once again say to ministers of health and to those that are in leadership of health governments throughout the world, now is our moment in time. This is our opportunity. We got the World Health Assembly resolution passed. Now it's time for the United Nations to also step up and to commit to prioritizing lung health, skin health, and rare disease in these areas.
That's absolutely stunning. The impact that these could have is so impressive, right? That it's exciting to hear about it. So what can we do? So we're sitting here, our thanks to all of you who are on the front lines, years of developing this, pushing it forward, talking to advocates, policymakers. If we are member organizations, individuals, what can we do to help this process move forward?
Well, that's what I really want to say to the members out there. So it may seem so vast and so big, like how do I as one person influence WHO? How do I as one person influence my Minister of Health? It's actually pretty simple. I mean, I know this is going to sound crazy, but we've done the hard work for you. So number one, we've got a change.org petition that all you have to do is click on the link at gaap.org lung health resolution.
Great.
And go to that change.org, sign your name. Done in less than a minute. That you're supportive of this, that you want to see this happen. And the more country representatives we get on that petition, the more powerful it is when we go to WHO.
Got it. That's important.
So that's it. So the change.org is number one. Number two, on that same link on GAAPP's website and on Global Skin's website for the skin disease, you will see a letter to your Minister of Health. So it is a downloadable, very simple letter that all you have to do is fill in your name, your country, and it automatically sends to the Minister of Health to say, please vote yes when this comes up.
Great.
At both the World Health Assembly and at the United Nations.
Excellent.
So one letter does the trick. And then the final way, so 3 ways. First is the change.org. Second is the Minister of Health letter. The third is social media. So we know that everybody out there is active on social media, that you've got Facebook and Instagram and LinkedIn. This is where we can like get the power of the voice of the community to really say, now is our moment in time. What I will tell you is that after 25 years of advocating in atopic and airways diseases, I wasn't sure that I would ever see this moment, right? Where we would have that platform, we would have that opportunity to say to the WHO, to say to the United Nations, it's the time.
Yeah.
Now is our moment, but we got it. And so we want you, we've already established like the social media tiles where you can just really quickly plug and play, download and post. And so please visit gaap.org/integrated health or lung health resolution. And that's where you can learn more and see those tools. And then also on Global Skin is where you've got the skin disease resolution tools.
And that's so important. So this is not something that you have to recreate. You do not have to design anything.
No.
They have all the graphics, the social media content, all the text that you could just put in and push out.
Yes. Plug and play. 10 minutes or less, I promise. If you take 10 minutes out of your day, you could get this done, mark it off the list, and know that you've been a part of this global change that, again, will absolutely change generations to come.
Amazing. That's amazing. Thank you so much for telling us all about this. It's really exceptional, Tanya.
Thank you. Thanks. I'm so excited about it. And again, I keep pinching myself that I will have that opportunity to be your voice in Geneva, to be your voice in New York, and that I'll be able to come back and report to you that we have been successful in our efforts.
We thank you for that.
Thank you. Thanks. And so again, don't forget, visit gaap.org, lung health resolution, and global skin for the skin disease resolution. Learn more about it, get involved, let your voice be heard, and stay passionate until next time.